Well, new details now in an 11 News I-Team exclusive. If you're one of the hundreds of Maryland residents who've told us they received unwanted COVID tests in the mail, Medicare says those days are over.
Yeah, the Centers for Medicare and Medicaid Services says it has now stopped paying for over-the-counter COVID tests and is investigating the increased number of complaints about unwanted tests.
I-Team reporter Tali Taylor joins us now in the studio. And Tali, you began looking into this back in May.
Hi, Kai and Deb. Yeah, that's right. So this all started with two viewers reaching out in May, and this is where things stand now. So since our last story aired about a week and a half ago, 92 additional people have reached out saying that they received unwanted COVID tests and that their Medicare was charged. That brings us to a total of 220 people. With Medicare paying about $96 per shipment, taxpayers are now on the hook for more than $143,000 for COVID tests that people never wanted or requested.
I think it's atrocious and that it shouldn't be happening, and whoever's doing it should have to pay the price for it.
Hopefully they can get this all straightened out and get Medicare to understand that if you have evidence of fraud, something needs to be done with these numbers, because I do understand they are numbers for life, but I'm not old enough to have a number that's been compromised, and that's my health care at risk.
Yeah, and those are just two of the viewers that we've talked to about this. Both their Medicare accounts were charged for tests that they never ordered. But now we're getting more information from Medicare, and an agency spokesperson tells me that they're now done paying for these tests that are sent in the mail, unless requested by people with a certain Medicare Advantage plans. And a spokesperson says in a statement, CMS has seen beneficiary test kit complaints increase, and CMS has identified instances of providers who started billing for an unusually high volume of test kits. CMS has taken immediate action to hold all payments for COVID-19 over-the-counter test kits and has implemented over 100 provider payment suspensions to date.
So, Tali, for the first time, Medicare seems to have sort of shared the behind the closed doors information on the cause and effect. What have you found out?
Yeah, that's right. So it sounds like the complaints increased. There was a high volume of these test kits being billed, and then Medicare pulled the plug on paying for them. So we've asked for more questions about, trying to get clarity on when Medicare stopped paying, as well as several other questions, but we haven't heard back yet. I should also point out that I put in several open-ended requests for interviews with Medicare, letting them know that I would do this interview whenever it suits them. But they've responded with a blanket no. Quote, "We are unable to accommodate your interview request."
Oh, a frustrating response there. There are a few things that for people to remember if they've received these tests or if their Medicare accounts were billed for them. They were billed for.
Yeah, that's right. So we've now had dozens of people reach out and tell us that they wouldn't have known that their Medicare was billed because they never ordered or received anything. But then they saw our reports and they checked their Medicare accounts. And so if you suspect fraud, or if you want to ask to change your Medicare number, you can call 1-800-MEDICARE, or you can find the link right now on the WBAL TV app.
And you can also find much more about Tali's reporting. Right now it's on the WBAL TV app. And if this has happened to you, you still want to hear from people as you continue to collect information about this.
Yeah, you can email 11investigates at WBALtv.com. And Tali, thank you. It was good reporting.
Thanks for having me.
Yeah.